Hi, this video is the art of hair transplant restoration surgery on an Asian guy who had a class 3-4 hair loss pattern, and he's completely bald from the front all the way to the back, and he's not even a single hair. And we did 2,600 grafts to be exact by the FUE method, and the result of this one is only one time. And as you know, sometimes it might need more than one surgery to have perfect density, but if you do it right, and with the high yield, and this one is over 90% growth and transaction rate very low, this is phenomenal, and I'm excited for him. As you know, is hair transplant patient like him having good result. I mean, the monetary is good for me, but the most important satisfaction and that I take most pride in is seeing the result that he has and make a difference in his life, change his self-esteem, his self-confidence, and his overall look, and it really gained his youth back. And when you have the hair, it really enhances your look. It frames the face when you have the lower hairline. It brings out your eyes, your nose, and all the feature that you're supposed to have that God created for you. And that's what hair can do. And this is the 1-year follow-up, give or take a few days. And this is what the patient looked like before, completely bald from the front to the back. And this is what he looked like right now. Extremely nice and natural. And just show the honest right side view, left side view. And this is what it looks like right now. And for more information, you can go to my website at www.mhtaclinic.com. Click on the before and after icon, and you can see multiple gallery. Click on the FUE gallery, you can see more pictures, or click on the hairline, you can see more, or click on the corner, or call 1-866-999-6482, or go into my YouTube channel. There's over 1,500 videos. Another favorite, you not only see the still picture of before and after hair transplant, but you can see the live patient, like what we're doing right now. And for this patient, he walk around spiking his hair, his youth back. And as you know, hair transplant, picking the right surgeon for the FUE is very important, because not everybody do the FUE the same way, and some clinic might cut corner, just use technician only to do the hair transplant by the FUE method. So thus can lead to poor growth. It might be cheaper, yes, but you talk about the surgeon operating on you or the technicians operating on you, big difference. Saving 1,000 but end up losing all that money, is going to go through all the hassle, so it doesn't make sense. So for this patient, he did quite a bit of research, and I'm very happy for him, and from the eyebrows. And when we talk about how natural it is, how do we achieve the naturalness? There's, Dr. Diep 8 rules, and the 8 rules that apply from the eyebrows to the hairline is around 7 centimeters, Asian 6.5 to 7, Caucasian 7.5 to 8, and then the more round the face, the more flat the hairline is, and his hairline is, and the more narrow the face, the more arched back the hairline is. So his is arched back a little bit, but not quite a bit. It's almost flat, but it's really zigzag, and we really zigzag up a lot in the front to put a lot of single hair graft in the front, followed by root to grow 2 hair, 3 hair in the back for bulk and volume. And you see the angle of the hair starting 35, 45 in front, increases when you go backward and changes when you go different directions. And we'll put a lot of single soft hair graft. And in front of it, we'll put a lot of straggler too. And it's just so many details when you talk about hair transplant, especially the hairline. So if you miss a step or you don't have experience, you can give a really wrong hairline, and thus can dramatically affect the overall look. So it is very important that you choose a surgeon and talk about the artistry of the hairline and how natural result, and then the density. And the density is by harvesting, the surgeon harvesting it. With me, I'm the one who designed your hairline. I'm the one who harvesting your hair graft, and I'm the one who create the site precisely by taking out your hair graft, measure to exact precise instrument that I will create. So when we make the hole, it will fit in perfectly. Because you don't want such a small hole with a large hair graft, and you try and squeeze in, you destroy it. Likewise, if you have a large hole with a tiny hair graft, it fall off easily. So hair transplant is 3 phases. Number 1, the surgical skill of the surgeon, harvesting how healthy hair graft out. Number 2 is the exact science measurement of measuring the type of tip, how to extract the hair out, and then the exact instrument to make the hole where the hair follicle fit in naturally. And the third and the most important is what? And what I wouldn't say the most important, but it's the aesthetic and artistic part. And all those details, you allow the patient to look natural. The old days, they just do the mature hairline, do really high, and the surgeon idea is that you should be happy just you have hair. But nowadays we don't do that anymore. Nowadays we want everybody focusing on the artistic and aesthetic part, not just the hair part. And so we focus both in all three phases, the artistic and aesthetic, and the naturalness and the density and the exact science to it. And this is the art of hair transplants again. And just to show the audience what, and I am going to open this, and you see the density is there. And we just comb back up for him. And just to show the audience what he looked like before and after. Before on the right side, after on the left side. This is what he looked like right now. Thank you.